Intimate skin care. This is something which is very, very pressing and people don't know who to discuss this condition with. I am Dr. Rasya Dixit. I am a dermatologist practice in Bangalore from the last 18 years and today we are going to be talking all about intimate skin care. So when we talk about intimate skin, what are we talking about? We are talking about the area of the skin which is the genital area. It could be the underarm area. These are the usually very covered area. This area has a specific significance in the skin. They have a different set of endocrine glands and apocrine glands which produce more hair, which produce more different type of smell, and there is always more sweat. And in this environment, which is a warm, humid, moist environment, there is a lot of bacteria and fungal overgrowth. So we have to always specifically care for these areas in a way which is different from using a regular body wash or a regular soap, and today we are going to talk about those specific indications only. Coming to what is the daily routine care for these areas. When it comes to cleansing of the underarm area skin or the genital area skin, we always recommend using a pH balanced gentle soap which can be used twice a day, and especially because India is a tropical country, we all are in sedentary jobs, we are always sitting in one place. Sweating and the moisture is going to help the overgrowth of the fungal infections as well as bacterial infections. So if you don't wash twice a day, you're going to increase the chances of getting infections, and you're also going to increase the chances of body odor, which is going to be very off-putting for you and the people who are working with you. So second thing is to wear fresh clothes every day. So you change your clothes. Don't wear the same clothes again, especially comes to underwear. Underwear has to be washed in hot water and Dettol and dried preferably in the sun, because the sun is a very good disinfectant that is going to help the clothes stay fresh, and therefore it is going to make sure that there is no infection coming back to the area. Let us now look at what about the hair removal practices in this area. Usually as dermatologists, we do recommend that you keep the hair trimmed both in the genital area as well as in the underarm area. So what are the methods of hair removal? Though we say shaving or trimming is good, laser hair reduction is a very convenient method of keeping the hair clean in this area, because treatments such as shaving, such as waxing, could induce folliculitis. Folliculitis is a very common bacterial infection. Bacteria is able to enter into the skin because of the opening in the skin, and repeated shaving and repeated waxing may actually make this intimate area highly pigmented. It's already prone for pigmentation, it might become worse. So repeated waxing, repeated shaving not only makes it more prone for folliculitis, but it could also make the area significantly more pigmented, and this area is already prone for pigmentation. So laser hair reduction is a very efficient method of removing the hair in this area, and it is a few number of sessions, and this can be done. It's quite painless and it's quite affordable as well. Make sure that the laser is being done at a dermatologist clinic under a dermatologist supervision, because it's a medical grade procedure and this is an intimate area. You don't want things going wrong over here. Third, we are talking about how to manage pigmentation in this area. We know that in Indian patients, the intimate area is always prone for pigmentation. This is called constitutional hyperpigmentation, and this is because we have genetically pigmentation more prominent in these areas like elbows, knees, underarms, as well as genital area. Now there is a lot of trends on what are the treatments that we can do to safely reduce the pigmentation in this area. For example, you may have unknowingly shaved the area or used some bleach in the area or done some treatment in the area which could have caused the pigmentation to become more worse. So for these treatments, there are gentle creams which have some glycolic acid, kojic acid, which are prescription based creams which will help to lighten the area. But remember, this have to be prescribed by dermatologists because this area is very sensitive. If you use an over the counter cream, you may end up using either a steroid cream which will make the skin, which is already thin, much more thinner, prone for stretch marks, or you might use something which is a very high concentration which may make the pigmentation more worse. So it's better to consult with a dermatologist and pick up a prescription grade skin lightening intimate area cream which could help to lighten the skin. Remember, now there are even intimate area chemical peels which are available, which are specifically designed keeping the Indian skin type in mind, and this is going to help to significantly lighten the pigmentation within 4 to 6 treatments. This can be done in both the underarms as well as in the genital area, both for men and women. In pigmentation which is resistant to chemical peels, even a Q-switch laser treatment and an injectable treatment of intimate area injectables also can help to lighten the area significantly better. Remember that some of the causes of this pigmentation could also be significant weight gain. Because of our sedentary nature of the job, we may also gain weight significantly, which adds to the pigmentation in the underarms, in the genital area, and also it adds to the concern of the butt acne. So if you are going to start this treatment journey with your dermatologist, remember metabolic parameters management, which is eating healthy, exercising regularly, and quitting smoking is as important as all the medical treatments I just mentioned. Then coming to the neighboring area, the butt, which is very much prone to butt acne. This is because most of us have sedentary jobs, we are always sitting, and there is a lot of friction which causes the folliculitis to come, and like I told you, these areas are more prone to pigmentation, so whenever the butt acne heals, it leaves a black mark. Again, we are back to the treatments which use glycolic acid, urea based emollients to exfoliate the skin, and again you can use a combination of chemical peels and laser hair reduction to treat them very efficiently. So a lot of us are now becoming more and more confident. We are looking for solutions which are beyond the face and beyond the neck, beyond the visible part of the body, because we are talking about body positivity. We want to enhance every part of our skin. So this is something that you do not have to be ashamed of or hide or not to be scared of, because I have a lot of people who come to me who are scared of wearing shorts or scared of wearing a bikini or scared of wearing something which is, a swimsuit, because they are concerned about this pigmentation. Remember that your dermatologist has safe skin solutions. So speak to your dermatologist today.